Hello, I'm Perrin, and welcome to the Business of Business. Throughout the pandemic, I'll be having a series of conversations with business leaders, government officials, and other experts on our progress in the fight against COVID-19. Well, few people are better qualified to talk about this topic than our guest today. Over the course of the last 15 months, it would be hard to think of another face that has become more familiar on Canadians' TV screens than that of Dr. Theresa Tam. Dr. Tam was a physician with expertise in immunization, infectious disease, emergency preparedness, and global health security, has been Canada's Chief Public Health Officer since 2017. She's a graduate of the University of Nottingham in the UK who completed her pediatric residency at the University of Alberta and her fellowship in pediatric infectious diseases at the University of British Columbia. She's a fellow of the Royal College of Physicians and Surgeons of Canada, and she has over 55 peer-reviewed journal publications in public health. She's also a graduate of the Canadian Field Epidemiology Program. Dr. Tam, welcome to the Business of Business.
It's great to be here. Thank you for having me.
Well, for the last 15 months, we've been in a very long and a very dark tunnel, but it appears that the exit is finally in sight. Reports suggest that we could reach 2 doses of vaccine for 75% of the population before the end of August. However, we still have a ways to go to get there. What can business do to help us to get to a critical mass of 75% of the population being fully vaccinated?
Well, thank you for that question. And I am very optimistic also because we do have some really effective vaccines. And I think for that, we should all be really thankful in Canada because, of course, it took tremendous efforts from a scientific perspective, private sector, collaboration, governments, and then a huge team of people moving vaccines that have been manufactured all the way down to the local level and into someone's arms. So I think it's been an extraordinary effort, and the vaccine effectiveness has been, from clinical trials has been sort of verified, if you like, validated in the real life situation. So that's really great. And we've had, I think at the last count this morning, about 36.78 million doses already administered, which means that we've already reached 77% of people in this country having had the first dose and 33% second dose. So we are well on our way, and there's enough vaccines coming in to allow us to achieve the goal of offering everyone a vaccine by the fall. But even quicker than that potentially, but it all depends on people rolling up their sleeves and continue to do so. And many can't do that without support from their employers along the way as well. So I think businesses can do many things, and many businesses have been doing the following things. One is to share evidence-based information with your staff or your community or your customers even, because there's a lot of misinformation or disinformation even out there. And as I said, supporting your staff in attending a vaccine clinic, lead by example. So business leaders can become vaccine champions, and I've been asking people, post something on social media, hashtag my why. I've been asking Olympians and all sorts of people to join in, and that helps people gain confidence. You're trusted leaders in your community, so I think that would really help. The other thing is that, of course, continue to follow the advice on local public health, because we do have different COVID activity going on in different parts of the country. And you can also, of course, get more information, encourage your staff to do so, from toolkits to other information that you can have from canada.ca or from Ottawa if you live in Ottawa, and your local community as well. I think that I'm sure everyone saw that amazing Scotiabank Arena vaccine clinic just on Sunday. That was 26,000.
That was a world record.
It was a world record. It was a local record, North American record, and then soon sort of escalated into a world record. And that could not have happened if it wasn't for different levels of government, private sector, Maple Leafs Sports and Entertainment, I think, Scotia Bank, but also the local hospitals, Michael Garrett Hospital, the University Health Network. So many people partnered together to get that underway. We had shots after dark in some, in Peel. We had Quebec. Quebec had corporate vaccination hubs. So CAE in Montreal, Pratt and Whitney in Longueuil, and then, lots of people volunteering to give up their space and their volunteers. So I think the tremendous results that we've seen so far in Canada and that we need to sort of keep up with is as a result of many businesses helping out as well. And if we can talk about how do we stimulate people to continue this, because I've actually said in my last update on my modeling work, the work of our experts, that we should shoot for higher. That gives us more of a cushion before fall starts, where viruses tend to transmit more, and it gives us a better defense and a cushion against any variants that might come along that might be transmissible. But so we should shoot for the stars. That's what I said, is go past that goalpost if we can. We've already passed the 75% mark. So I think, if things are aligned, if businesses can think of novel ways to engage communities, to maybe incentivize or support people in terms of access to vaccines, we're definitely going to go for gold, basically.
I would drill down a bit there in that we're seeing record numbers of Canadians coming in now to get their second shots. And we're not seeing the same degree of vaccine hesitancy in Canada as we see south of the border, for example. Yet while we're seeing second shots taking off, we're seeing a plateauing now of the first shots. What constitutes, in your view, what constitutes herd immunity? What level do we have to get to before we actually reach that level of safety?
Well, the modeling that we did suggests that you can lift these more restrictive public health measures. Business wants to see that, right, of course, at that sort of 75% first dose, over 20% second dose. This was before the Delta variant came along. And then the 75% to those to begin to reduce those, even the individual personal protective measures. With the Delta variant, we suggest a higher coverage. That's just to limit a fourth wave that can overwhelm your health system. That's what that modeling shows. We were not trying to eliminate the virus or to, suppress it altogether. I think so it wasn't really about herd immunity as such. It's how do we get back to more normal activities and not overwhelm our health system. And so that's how those targets were initially put out there as potential goalposts. I think herd immunity depends on a number of factors. It depends on how much infection has already occurred in the community. It also depends on the virus. So the more transmissible viruses, such as the Delta variant that people might now be aware of, needs a higher level of vaccine coverage. So it's not a hard and fast, sort of specific measure. It may vary, but I certainly think that shooting past 75% is a really good trajectory to go for.
Let's take a little bit closer look at this. I think what you're saying to us is that we shouldn't assume that the disease someday will simply disappear, that we are actually going to have to live with this disease on a recurring basis and manage the risk as opposed to eliminating the risk altogether. Is that correct?
I would say that is definitely what I think we should be prepared to do, because the virus is found in every corner of the world, including the 2 poles of the earth. And so it is very hard to get rid of. And while Canada is progressing well with our vaccinations and we have supplies to offer to the whole population, there'll be so many countries that are not in this very fortunate state. So as a result, it would be years, I think, before we know what will happen to this virus, and we would have to manage um, to essentially manage the fact that this virus is not eliminated, and but we can then suppress the level of activity through vaccination, but also maybe continuing some of the habits that we already learned in the last 18 months to reduce our risks while trying to resume activities in our social and economic space that is closer to what we were used to before the pandemic. I would also say that, in the summer, I think it's much easier to control any viral transmission because you can go outside, better ventilation, and there may be a seasonality to this virus. But when we come to the fall, not only and provinces open up their activities again, we're going to have to monitor this very carefully. And as the vaccines continue to go up in terms of coverage, in the fall, the other concept is that there'll be other viruses, because we actually did really well. There was basically no influenza in the last year, which is astounding. And so come this fall or this winter, it's possible that we're going to have a resumption of all the other respiratory viruses. So we would have to continue to monitor and to test people so that we know whether this is actually COVID-19 or is it influenza, is it RSV, which is another virus that commonly occurs in the winter, particularly in kids. So all of that, I think, is in our future. But we think that with highly effective vaccines, high vaccine coverage, together with some of the safety plans and the sensible measures that people can use to reduce their risk, we can then manage much better than we would have done last year, for example, without the vaccine in place. So I think all to say is the vaccine adds a really critical layer of protection that will allow us to do more in the coming fall.
Looking at it from a public policy point of view, is the single most important criterion the protection of the healthcare system, that it doesn't get overwhelmed by cases flooding into emergency wards?
That's certainly I think, critical indicator, if you like, to look at. I mean, first of all, I think everyone has now become quite familiar with epidemiology. I think we were saying that everyone is an armchair epidemiologist now. People are used to seeing graphs of what's happening with the epidemic. So what I'm watching for is, obviously a resurgence in cases. We talk about this thing called the reproduction number, which is, are things escalating in such a way that one person is passing the virus to more than one person, and then it goes on and on. Right now, we're seeing that reproduction number being suppressed to below 1 for many weeks now. That's a good sign. If that starts to climb, that's the first signal as well that the virus might be beginning to spread, and you can do something about that. And so it's better to do something early and fast to avoid a later, more serious impact. But because what we're finding, and more we're getting this data, is that the vaccines are very effective in preventing serious outcomes. So the first sign that we saw was the impact of the vaccine in the long-term care facilities. During that third wave, without the vaccine, we would have seen much more impact in the high-risk populations. And so I think that was one of the key indicators, is that there's that reduced mortality. What we would like to see, of course, is even if the virus is case rates are climbing, that we don't see the hospitals filling up or the ICUs. That is a really critical measure. So that's why we did some of our modeling based on, is it overwhelming our hospitals? And because we got to resume healthcare, you got to resume elective surgeries and all the other medical procedures and appointments that people need to catch up to. So it is a very important factor, but it's not the only factor, of course. So I think, you know, we have to monitor things from all different angles. And Canada's a big country too. So what's happening in one end of the country isn't necessarily the same as the other. So at the national level, even though we monitor these national indicators, what we have to do is really to drill down to more to the provincial and local level as well.
Doctor, let's talk about the efficacy of vaccines. You mentioned, for example, that previously when you gave projections, that was before the arrival of the Delta variant, which appears to be much more virulent and dangerous. On the other hand, you've also mentioned the fact that since vaccination, we've seen in long-term care facilities fewer people getting sick and dying, that even in the cases where people may be vaccinated and still catch the disease, the severity of the disease and the likelihood of them passing it along to somebody else is considerably lower. Can you comment on the importance of vaccination in terms of reducing severity and reducing infectiousness?
No, that's a really important question. And just to clarify something that you said, so we are monitoring the viruses that are circulating and doing genetic sequencing so that we know what what variants are in circulation in different parts of Canada. And that's a really important aspect of surveillance. And the variants that we are concerned with are the ones that have the propensity to spread more rapidly, or to cause a more severe outcome, or evade our tests, or actually have an impact on our vaccine. The last sort of indicator is very important. So all of those factors, are part of the risk assessment for the different variants. So we've encountered a couple of variants that I think everybody is sort of familiar with now. The Alpha variant, that's the B117. Originally, that's what it was called. This is now a Greek alphabet of variants. And the Delta variant is the latest one that we're keeping a close eye on because it has an increased transmissibility. It spreads more readily, which means you need a higher level of vaccine coverage to reduce transmission of this variant. Two is that there is some data coming out of initially the United Kingdom, but some initial data from Canada as well to show that people infected with Delta variant, a higher proportion of them are hospitalized. So that's the increased severity of the virus, but that's still being analyzed right now. But the good thing is that the vaccines are effective against all of these variants to a huge extent. So even if they have a slight reduction in vaccine effectiveness, they are still effective. Some of the initial data that came out of the United Kingdom, for instance, on the Delta variant is that just one dose of vaccine wasn't as effective at reducing illnesses, in symptomatic illness. 2 doses of vaccine gave much better vaccine effectiveness outcomes. But then we had yet another set of studies that show actually the first dose was indeed quite effective against serious outcomes. So even though it wasn't as effective against the initial estimate of symptomatic illness, it seemed to be quite effective at reducing hospitalization. So that is good news. So what I would say,
it validates Canada's strategy of stressing first shots.
we still need to push for first shots. And so and some of these data comes out of the higher risk groups, the seniors. So what I would say is if it's really effective for seniors, it's going to be as effective, if not more effective, for younger populations with a more robust immune system as well. So I think that so far, the studies are validating the fact that we have some extraordinarily effective vaccines. And but we will continue to monitor to see if vaccine effectiveness is being impacted. There is a bit of a reduction in vaccine effectiveness, but still great. So the bottom line is still go and get your first shot if you haven't had it. But 2 doses are really important, so don't go halfway. The second dose really helps increase, we think anyways, increase the duration of that immunity and broadens and strengthens your initial priming of your immune system. You get a boost. And so so all of that is looking pretty good. But one way of suppressing the emergence of variants is to keep viral transmission low. So if you keep your cases low, the chances of variants emerging is reduced. So we do have to have international collaboration, because as I said, many countries don't have vaccines right now. And I think in order to protect Canada and to reinvigorate the economic space, helping other countries get the vaccines that they need is going to be critically important in the next stages.
Doctor, businesses are preparing now for the reopening, whether it's going to be in the next few weeks or whether it'll be in the fall. The assumption is that we have to be prepared in advance, and they're currently navigating really a maze of different regulations from jurisdiction to jurisdiction and competing advice as well. What advice would you give to businesses in terms of what they have to look at for their planning for reopening?
So as I said, Canada is a massive country in that it is important to look at the local disease indicators, so science. So have a look at that data, because if you're in Waterloo or the Porcupine Health Unit right now, you're a bit different than even Toronto or other places. So continue to link up with your local public health and your local data is really important. I think that what I've been advocating is, given that, then do the lowest risk approach is to do it in stages. So, and I do think even though the provinces have different, obviously different approaches, they are taking things in stages. And the idea is that there should be enough of an interval for you to assess what happens when you open your initial stage and then you move on to the next one. Because what you want to try and achieve is a sustained path forwards instead of keep going backwards, right? People don't want that sort of yo-yoing effect. While at the same time, be prepared that if in the world some other variant appears for which we have to reapply certain measures, then that may have to take place. But what I would like to see by that time is then it becomes more of a targeted approach than a more broad-based blanket approach that had to be done before we had vaccines and other measures that we've learned over time. So, so I think, which is why, despite the fact that I think people are seeing different advice in different areas, the more localized approach does make sense, because you can't make things too broad anymore. You want to sort of detect the fires and try and extinguish them early. And then the idea being that you don't have to then broaden out the approaches as much as the authorities at the provincial and local levels have had to do in the last year and a half. I think that without the vaccine, it would be difficult. It would be very difficult to look at a more sustained path forwards. But what I will say is, we do have to be cautious, because look, one interesting example we have going on domestically right now is Yukon. Yukon has managed really well.
Yeah.
In the over the whole of the last year and a half, and they have very high vaccination rates. And now they're dealing with an outbreak bigger than what they had before in the unvaccinated population mainly. So as you reopen up that space, you got to prepare for the fact that outbreaks could still happen. That was occurring prior to the increase and broadening of the vaccine offering to the younger age groups, because now all provinces and territories are now offering the vaccine to the 12 years and up. So with higher coverage in the younger age groups, it is potentially that could have been reduced in terms of the spread in the territories. But it just tells you that even with that kind of level of coverage, the virus will find the unvaccinated, and it's going to find pockets of unvaccinated areas, and that we would just have to prepare for this. And why I actually think younger adults actually want to be vaccinated. I think it's a bit unfair for us to say, oh, we haven't had high enough vaccine coverage. They haven't been offered the vaccine that long. It's just recently, right? So I do think that making sure that there's access, that we align with, making it easy for them to get the vaccination, maybe with some incentives, possibly from their employers, would help them get vaccinated. And we know that from a disease transmission perspective, younger adult populations, for example, are the higher transmitters because they have more social connections, they have more mobility. And so if we can get the vaccination up in those age groups, the working adults, that all of your employees, for example, will really help reduce transmission.
Can we touch on rapid testing? It's one area where the Chamber Network has been working closely with the federal government and the provinces to distribute rapid test kits to small and medium-sized businesses across the country. What role do you see for rapid testing?
Well, first of all, thank you so much for the Chamber, for Canadian Chamber of Commerce, in partnering with the federal government and other government levels as well. I think having these test kits available to workplaces can really help. I believe Ontario alone has passed 2.6 million mark in your tests distributed. So kudos to everyone. This is superb. And so what is the role of testing going forwards? And so that's a really important question. And I think that, as we just said, this virus is not eliminated. And it is important to maintain a level of surveillance and screening in the population. And so that in the short term, as provinces reopen, we actually don't know what the activities are going to be. Where is it going to spread? Do we have high enough vaccination levels? Are there pockets of under immunization? So, but the testing in workplaces, I think, can help detect, viral transmission earlier, and maybe then help local public health in actioning earlier. And as I said, then it becomes a more targeted approach rather than bigger blanket approaches. I think that what I haven't seen the data, but I think collecting the data and analyzing it in terms of what is the outcome of your workplace testing will be extremely helpful to look at the next stages of the policies. Not just the results of the testing, but the acceptability, the feasibility. How do we improve workplace testing would be very important. The workplaces that I've been more familiar with are actually some of the high-risk workplaces that I think are really important. Think of some of the biggest outbreaks and places that we need to support are meat packing plants, agriculture sectors, our temporary foreign workers, the mines. Having an outbreak in a remote mine is really a challenge. So making sure people get vaccinated, but also still having testing in place. And the rapid test may not be the only layer of testing. We've been trying to encourage and pilot wastewater testing and other layers of detection to give early signals. So that's important. So collecting the data, I'm actually quite interested in the fact that you've been collecting data and you've been piloting rapid tests during a third wave. So when the prevalence is high, the viral load, in your community is high. What does it look like when in non-wave context? Can we collect some information on that to give us some idea of what testing is like? How do the testing perform under that setting? We have hypotheses about that, of course. How would the testing look different in terms of the performance in an area of high vaccination compared to a pocket of low vaccination? Is that then where we would make sure we have more rapid tests, for example? That would be very interesting, I think. We are certainly conscious of the fact that after vaccination, the viral load in the in the sample could be low, and maybe the rapid test won't be as effective. But only the data will tell in terms of, well, then do we put more attention, as I said, in areas of low vaccine uptake? Where it continues to be important, as I said, the cold and respiratory virus season is coming. And if we maintain some personal hygienic measures and the hand washing and masking and staying home when you're ill, making sure ventilation, HVACs are up to maintenance, that might help reduce things like we did last winter. But I bet you some of these viruses have come back. Then how would you tell? How would you tell if it's COVID or if it's rhinovirus or some other entity? I actually think then your workplace testing might help us to sort of discern some of these trends. And then, well, if a variant that is an immune escape variant occurs, then the first thing that's going to happen is it may occur in even a highly vaccinated population. I still think that the most valuable use of rapid tests are during actual outbreaks. So if you do have a local escalation in numbers of cases, deploying the rapid test broadly will help find the edges of that outbreak and help kind of limit its spread. But as we all know, this virus is very difficult. I think my minister calls it a very sneaky virus because the asymptomatic people and mildly symptomatic people can be infected and pass it on. And so this is, those are some of my reflections in any case on the application of workplace screening.
Dr. Tam, the clock is fast running out, but if you'll bear with me, I'd like to touch on just one last subject before we wrap up, and that's, is it too early to talk about lessons learned? We don't know what the next pandemic is going to be, but we know that there will be one. What have we learned from COVID that will be helpful for us in preparing for the next pandemic?
It's never too early for lessons learned, I think. We've actually been through many months of the pandemic. So as the Chief Public Health Officer, I actually did a report last year, my annual report on the broader impacts of the COVID-19 pandemic. So it's not just the impact of the virus, but the broader impact during that year. And a lot of my focus has been on the fact that pandemics, including COVID-19, impacts everyone, but some more than others. And so I think that we need to build in the health equity into pandemic plans. Seniors, people with underlying medical conditions, but those who are essentially equity deserving, First Nations, Inuit and Métis communities and individuals, homeless, people experiencing homelessness. You could tell before a pandemic arrives that certain populations are going to be at high risk, and that simply must be fundamentally built into pandemic plans. Pandemic plans are necessarily multi-sectoral. The public health sector, the public health system, is a relatively small system in the context of a bigger health system. And of course, increasing capacity and the lessons learned in the public health system is important. But I think what is really fundamental is that the ability for the public health system to flex and surge is dependent on partnerships and collaborations. So I think one of the key lessons learned, maybe just to take stock of how the private sector has contributed and how do we forge those relationships and collaborations going forward, so that the pandemic response clearly is always going to not just impact health, but there's a bit broader recognition that it has social and economic impacts. So for our decision makers, our political decision makers, it's really important to emphasize that point. And I think everybody recognizes it now, but maybe in several years' time, people forget that pandemics and viruses have a big economic and social impact, and we need everybody, all hands on deck. As I said, it's not just the Minister of Health, Minister of Industry, ministers in charge of social supports, housing. They're all in this in terms of the response. So that's really important. One other thing, one of the key lessons learned is social cohesion. And I think this is where Canada continues to excel, and how we're coming through this pandemic together is that it does take all of us coming together to build trust, to reduce that disinformation or misinformation, to build the community trust, the kind of groundswell in the volunteers, in people supporting each other through tough times. But the fact that there is social cohesion means that the public health directives or measures on the ground works, because people fundamentally do try and do their best to follow them. And I've of course spending a lot of time looking at the public health system itself, from the need for data and the more rapid collection of data, this aggregate data for different populations, so that we can target and support those who most need support. But so I think there is never time to sort of I always think I was reflecting on this morning. It's like the ghost of public health, past, present, and future. I'm very seized with the current context and the focus on the response, but at the same time looking at the past so that we can adjust the present context, but also then looking into the future and say, well, how can we strengthen our response going forwards? I hope that the business sector can help us all remember that it's a collective and multi-sectoral response that's helped us see the light at the end of this tunnel, and to support each other as we're going through what will no doubt go down in history as one of the biggest, not just health crisis, but a societal response in recent times.
Doctor, this is a conversation that's going to continue for a long, long time, but sadly today the clock has run out. Thank you so much for being with us today, and thank you for your tireless efforts. I don't know whether you've had any time to yourself over the course of the last 15 months, but you have certainly been tireless in terms of working on behalf of Canadians. We're very grateful for that, and we're grateful to you for being with us today.
Thank you so much, and thank you for your business leaders and the Canadian Chamber of Commerce for your interest. It's a pleasure.